Hello all, myself Nushida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today, my mentees are going to present a design thinking based case study on periarthritis shoulder, which is commonly known as frozen shoulder. Design thinking approach helps us to create a patient centered treatment approach and also which involves a problem solving approach in treating any patients. To start by step, the first step is to empathize.
First step is empathize, which is understanding the person. Our person is a 52-year-old age, a female. He was a home worker and pain in the right shoulder, a progressive resistance movement, difficulty in activity like combing hair, dressing and reaching over the head. Pain worries at the night. She had a symptom for 4 months and reported disturbance of sleeping and fear on movement. So, by empathizing, we understanding the present main concept is pain relief and regaining the shoulder movement, ability to perform the daily activities independently.
Next, define identifying the problem. Based on subjective and objective assessment, pain on active and passive shoulder movements, marked resistance of external rotation, abduction and flexion, end range pain and capsular tightness. The clinical diagnosis was periarthritis shoulder in freezing stage. The core problems identified were pain, inflammation, reduced joint mobility, functional limitation of the shoulder.
Okay, and the next step is the idea about the planning of treatment. Here are the certain goals like reducing pain, muscle spasms, joint stiffness, and in promoting to the aerial activities and improving the joint range of motions. And combination effects like the wax bath therapy with exercise modalities like reducing pain and improving blood supply.
Yes, the next step.
Step 4 Prototype Treatment Implementation. Paraffin wax therapy, temperature 45 to 50 degrees Celsius, method drip and wrap technique, duration 15 to 20 minutes, frequency once daily, 5 days a week. Physiological effects, it increases blood circulation, reduces pain and muscle spasm, improves soft tissue extensibility, prepares shoulder for exercise. The therapeutic exercise was started immediately after wax therapy. Pendulum exercise to reduce pain and initiate movement. Active assisted range of motion. Shoulder flexion, abduction and external rotation. Stretching exercises. Posterior capsule stretch, cross body stretch. Strengthening exercises. Isometric exercise for rotator cuff muscle. Progressed to resisted exercise as pain reduced. All exercises were taught as home exercise program.
I am here to say about the step 5 test outcome evaluation. After 3 weeks of treatment, the outcomes were significant reduction in pain, improved shoulder range of motions, better performance of daily activities, improved sleep quality, increased patient confidence in complications. The outcomes are measured as a visual analog scale and the ROM assessment were the positive. Thank you.
Yes. To conclude, the design thinking based approach helps us understanding the patient need and also helps us to solve the patient's problem as a pain and stiffness is their major concern. So we can use the design thinking approach in the case study to solve it in an effective manner by step wise. So that in conclusion, paraffin wax therapy followed by exercises like pendulum exercises and also the stretching of the capsule and also mobilization of the joint and also the surrounding muscle stretching will help us to relieve the pain in an effective way so that it is effective in conservative management and also in case of the non-conservative treatment which followed by the surgical therapy of any rotator cuff tear or any of the joint adhesion post surgical stiffness also we can use the paraffin wax therapy as a main treatment to increase the range of motion and also to break the adhesion and also to break the stiffness that will give you an enhanced range of motion in the paraffin wax therapy post treatment. So we have to frame a protocol as such we discussed using the design thinking approach. First, we have to empathize what is the need of the patient. We have to understand what the patient comes to us and what is the major concern. Like in case of the home worker or in case of housewife, the patient main concern is to difficulty in carrying out the basic day-to-day activities. So that kind of understanding is much needed in our physiotherapy role. The next, to define the treatment, we have to understand what kind of condition is that and in which stage the patient is came to approach us. And in the next stage, we have to ideate what we are going to give a particular treatment to the patient. And in prototyping, we have to emphasize the patient to do all the exercises which we have mentioned in the treatment session, and we have to follow up accordingly. And to test after the follow up, we have to test the outcome of the treatment, whether it was effective or not. So these kind of treatment approach will give you a better consultation approach in treating the patients. So hereby, I suggest you to use the design thinking approach in seeing the patient and treating them effectively. Thank you.